welcome to the Internet of Healthcare conference here in London. I'm Doug Drinkwater, the editor of Internet of Business, and I'm joined this morning by Tim Omer, who I'm going to describe as a citizen hacker who's done some really interesting things with essentially hacking his own glucose monitor. Give us a recap on what you've been working on this last 12 to 18 months, because you've been doing some really interesting things, essentially pairing wearables and traditional medical equipment to drive more real-time insight into your diabetes.
So I'm part of a wider community that goes under the hashtag or We're Not Waiting. And in a nutshell, they're basically type 1 diabetics who are fed up with a lack of access to the information and data that the devices provide them and how they can manage their conditions via that. So I've taken up projects working on a mobile-based app to actually help develop a open-loop artificial pancreas system.
And talk us through some of the tech that's involved. I believe you've been using Raspberry Pi, and obviously you have the smartwatch, the Android smartwatch. Talk us through how everything interconnects and what it gives you ultimately.
Well, it's a very good question, and there's many different elements as well. And these all come from different projects that the community have contributed. They're all available open source. So on one side we have the use of continuous glucose monitors. That the signal is picked up by a device called an X-strip that looks like a small tic-tac box with some very cheap off-the-shelf circuitry that then relays it to your mobile phone, and there's an X-strip mobile phone app. Now that game was created by the wider community and provided for free. You then also have the openaps.org project. They've developed a blueprint of an artificial pancreas system and an algorithm that can work with a Raspberry Pi and many other different boards that could potentially support it. And what I've done personally is taken the work that they've done and actually developed an application on my mobile that utilizes their code and gives me information to help me manage my condition. That works via my mobile phone and also via my smartwatch. The smartwatch, great interface to easily accessible.
Yeah. What benefits have you seen? 'Cause I know before when we spoke, you were mentioning how difficult in the past it's been to get that information, but now it's obviously real time. You can see good times, but you can basically evaluate your health much more on a real time basis.
From a very simple perspective, just by transferring the CGM data from the manufacturer's device, that's normally in your pocket or a bag, onto your watch in itself is pretty life-changing. I've now have real-time information and real-time location. With the app that I've been working on with the community's code as well, is that now I have the same data that I was producing before. I'm capturing it as well more easily. For example, it's easier for me to log my meal information and well-being on a mobile phone app than it is to write it down. And as that data is all connected, the team who work on OpenAPS, I utilise our algorithm then to give me medical suggestions. So we've gone from a situation where we had to be very reactive to our technology and data to now that data and technology being proactive to help me manage my condition.
I think when people talk about IoT in general in healthcare, they generally think they've got this vision, for example, of the fridge, which orders your milk for you. You kind of mentioned about open loop. That suggests to me, and I think we touched on this in our conversation, that there's still obviously some manual input. You still obviously have to administer the insulin.
Yes, so the application I've worked on, unfortunately we do not have access to the insulin pump that I utilise. So that's known as an open loop system. So my application every 15 minutes would give me a notification on my watch if an adjustment's needed. I can acknowledge that and I'll execute it on my pump. While yes, that is a slight manual element to it, but what it does mean is that we can support almost any insulin pump because the individual's the gap in that middle. And that also has many other benefits regarding even from safety to support. And the element here is not to completely automate the condition, it's to assist the patient with their management.
Tim, really appreciate your time. Enjoy the rest of the conference.
Not a problem, thank you.